Okay, to treat anaphylaxis in the dental office, we have two options. We can either use the EpiPen, or we can use an ampule of epinephrine and a syringe. Let's look at using the EpiPen first. The EpiPen is good if we don't want to have to draw up the medication ourselves, if we don't want to have to worry about, in an emergency situation, drawing up the correct amount of medication. With an EpiPen, you just simply remove the blue tab at the back, and your pen is ready to go. You inject in the lateral thigh. A couple things about the EpiPen though. One, it's expensive. I just heard they're coming out with a generic version, so it's going to become a little bit cheaper. However, you have to have both an EpiPen adult and an EpiPen junior in your office, so your costs are still going to be more than if you use an ampule of epinephrine. The other thing about the EpiPen is that the needle is only about 5/8 of an inch, roughly about 15 millimeters, so it's small. If you're giving this in the lateral thigh through the clothing on a larger individual, you may not even be injecting the medication into the muscle. You may be getting it more into the subcutaneous area, which may be effective, but it's not going to be effective quick enough or as quickly, and it won't be as effective as if you give it in the lateral thigh. If you've got an ampule of epinephrine, which you can purchase for about $4, and you've got a 1 cc syringe with at least a 1-inch needle of about 25 gauge, you don't have to have more than one different EpiPen in your office. You can draw 0.3 cc's of a 1 to 1,000 concentration for an adult, or 0.15, half of that, for a pediatric patient. Let's look at drawing up the medication from an ampule. Simply break the ampule, insert your syringe, draw up 0.3 cc's of the medication, and we're ready to go. Inject it into the lateral thigh, and we're done. Pretty quick and much less expensive. Thanks for watching.